I'm Sally Harvey. I'm Acting Chief Executive for RNIB. I started that role at the beginning of October, but I've actually been with RNIB since 2009. Started managing Scotland, Northern Ireland and Wales. I was seconded for 18 months to lead what was then the creation of something that became RNIB Solutions, which is our business-to-business focus, our commercial activity. And most recently, I've had responsibility for our schools, our college and our adult residential services. So a lot of experience across the world of RNIB. RNIB is going to be 150 years old in 2018. So looking forward and planning for some celebrations around that. It's interesting looking back. In some ways, we've changed significantly. I think the main thing for me there is how we are very much now an organisation of blind and partially sighted people. RNIB is about being part of blind and partially sighted people, part of the organisation, really driving everything we do, their organisation, not ours. RNIB has a 5-year strategy. We've got 4 key kind of priority areas which set the agenda for everything we do. So those 4 priority areas are being there for people when they are told the news, usually in a hospital setting, that there's nothing more that can be done to save their sight. To support people to live independently, to ensure that the world around us is actually inclusive and a good place to be. And lastly, prevention. Blind and partially sighted people have told us that they do want us to play a part in preventing avoidable sight loss. So those 4 pillars kind of shape the work that we do. Prevention kind of takes many forms, and obviously there'd be a number of organisations who would be focused on medical research, for instance. We don't believe that our resources are best spent in that area. The focus that we've taken is twofold really. It's one around the eye health message, working with others in that respect. This cannot be and will never be just RNIB. And the second area of focus for us is then ensuring actually the timely interventions. Our partnership with Specsavers actually is something that's very exciting for us, and it is particularly around that eye health message. For us, it was a big opportunity to raise RNIB's profile, but the important thing was actually about that shared sense of clear purpose, that we both had an interest in developing the eye health messages and getting them out there. And we hope that relationship will develop and flourish, but not exclusively. And I think that's an important message I'd like to give. I mean, RNIB works with lots and lots of different organisations across numerous sectors. We really cannot do it alone. It's not our place to do so. We have a role to play, as do others. So, we're looking all the time for partnerships, big and small. I think compared to other sectors, I would be optimistic around how we work together as a sector, and I think the reason for that is the existence of the UK Vision Strategy. That's really provided a focus for both the eye health and sight loss sectors in its broadest sense to actually kind of pull together with some clear messages. I think we could do more. There's always more to be done. The strategy itself is being refreshed this year. The RNIB does have concerns about the financial constraints that the NHS are under. I think a combination of finding new ways of delivering services, but also in the more immediate term, making sure that people aren't losing their sight unnecessarily because of treatments being delayed. So we're doing a number of things to get that message across, and that includes going directly to Jeremy Hunt, for instance, who has recognised the evidence that we presented to him in terms of delays and has asked that NICE bring forward their recommendations in terms of treatment. So we're pleased that step has been taken. It remains to be seen whether that makes a difference. So we'll campaign at whatever level is required. It's something we do feel very, very strongly about. The world is changing around us very, very rapidly. We cannot deny the need for us all to make sure that every pound of public money, in our case, kind of every pound of donors' money, is spent wisely. So Absolutely, we have a responsibility and I think the opportunity to take that step back and see what we believe can be the difference we can make. Technology advances create huge opportunities for blind and partially sighted people. I mean, I think probably one of the ones that most people would say they're excited potentially about is driverless cars, which we've kind of involved in a number of the projects that are going on around that. So yes, some very exciting projects, tech projects that are taking place.